Okay, let's dive into this. Welcome to today's explainer. We're going to be taking a really close look at the Australian intern written exam. But, we're doing things a little bit differently this time around. Instead of just talking about the exam, we're actually going to put you directly in the hot seat.
So, I've got to ask you right up front, do you have what it takes to pass the Australian intern written exam? Well, we are about to find out right now with a rapid-fire try-it-yourself challenge.
But hey, before we jump into the gauntlet, let's just quickly define what we're dealing with here. The APC written exam is the required written assessment used in the path from provisional to general pharmacist registration in Australia. Basically, it's that absolutely crucial bridge you literally have to cross to achieve general registration.
Now, it's a 120-minute restricted open book test, but seriously, don't let the phrase open book fool you. This exam heavily tests your applied judgment in real healthcare settings, all under strict time pressure. It's not just about memorizing facts. You've got to read a complex case really fast and then choose the safest, most effective action.
All right, let's move to our first live demo and see how this builds. I'll read the question exactly as it appears in the source material. Here we go. A 45-year-old office worker presents with a 2-week history of right lateral elbow pain that worsens with gripping and wrist extension. Resisted wrist extension reproduces the pain. Which of the following is the most appropriate initial physiotherapy intervention? And your options are A, ultrasound therapy to the medial epicondyle, B, eccentric wrist extensor strengthening with progressive loading, C, immobilization and a full arm cast for 4 weeks, or D, cervical spine mobilization at C5, C6. Take just a quick second to lock in your guess.
Okay, time's up. The correct answer is B. Moving right along to question number 2. A 65-year-old patient presents to the emergency department with sudden onset of right-sided hemiplegia, aphasia, and facial droop. Which type of stroke is most commonly associated with these symptoms? Let's look at your choices. A, right middle cerebral artery infarction. B, vertebra-basilar stroke. C, posterior cerebral artery infarction. Or D, left middle cerebral artery infarction. What do you guys think it is?
Got your answer? The right answer is D.
All right, let's hit the final, highly specific demo question to test you one last time. A 58-year-old male presents with bilateral lower limb incoordination and difficulty with rapid alternating movements. Clinical examination reveals dysmetria on finger-to-nose testing and positive Romberg sign. Which cerebellar lobe is most likely affected? Your options are A, flocculonodular lobe, B, anterior lobe, C, posterior lobe, or D, vestibulocerebellum. Go ahead and lock it in.
And the correct answer is C. So that concludes our interactive challenge block. How did you do? Did you get all 3?
Now for our next section, master your preparation with easyquiz.com. So the crucial point here is, if those questions felt pretty challenging, you really need the right tools to prepare. That restricted open book setup can totally trick people into thinking it's going to be easy, but as you just saw, that time pressure is very real.
To actually study effectively and manage that intense time pressure, we highly recommend easyquiz.com for your exam prep. They offer this incredible online web simulator featuring over 500 up-to-date questions, 120-minute timed sets to rehearse your pacing, and auto-learning features so you can check your errors right away. Plus, and this is super handy, they have a mobile app available for both Android and iOS that works completely offline. It is literally perfect for practicing anywhere, anytime.
Because look, with the right practice tools, passing the Australian intern written exam is entirely within your reach. So are you ready to test your limits and start studying today?